When folks look at risk management and patient safety, what we find when we really dissect a case often is that there is a breakdown in communication. And that breakdown in communication can appear at multiple different levels or multiple different steps along the healthcare delivery system chain. It can be physician-to-physician communication. It can be patient-to-physician or physician-to-patient communication, be physician-to-nurse communication, and oftentimes the breakdown occurs at sign-outs. So one of the things that we've tried to emphasize is the role of communication. And for example, in sign-outs, we try to emphasize a concept called SBAR, S-B-A-R, which is situation, background, assessment, and recommendation. So if we speak the same language when we are discussing patients, we're less likely to miss things. The other piece that I think is so important for folks to recognize, and I'm in a field that involves surgery and procedures, so I feel very comfortable in making this statement, we need to be very proactive in viewing communication as a procedure. So oftentimes, if I am speaking to folks about the role of communication, I may start that talk by saying, what's the most common procedure that you do? And if it were to be a group of obstetricians, they may answer cesarean section, or they may answer hysterectomy, or surgeons may say laparoscopic cholecystectomy. And I'll challenge them to then think about, no, actually, the most common procedure you do is communication. Because we have to always remember that we speak the language of medicine, which by essence, I like to say lightheartedly, all of us at minimum are bilingual. We speak our native language and we speak medicine, where patients do not often speak the language of medicine. So when we're speaking one language, the language of medicine, and using all of our terms and syllables and acronyms, and the patients don't understand it, imagine if I were speaking French and the patient only understands English. So we have to break the barriers of communication and ensure that patients truly do understand what are we saying. One of the concepts of enhancing education, and particularly at the medical student level, is moving away from the find it, fix it model. We as clinicians are trained diagnosis, treatment. We're always thinking about the assessment and the plan. And when we want to break the barriers of communication, i.e. help the patient understand our medical language, we have to really think away from the find it and fix it and think about educating our patients, engaging our patients in the conversation, enlisting them, and then empowering them with their health. For example, we may make a recommendation to a patient about a certain procedure or a certain medication. And we may say to the patient, so do you agree that this is the right medication for you, Mrs. Jones? Where a better question would be to say, Mrs. Jones, on a scale of 1 to 10, how confident are you that this medication is going to help you? And the studies have showed that if Mrs. Jones gives you an answer less than 8, you have not truly engaged and enlisted her in this treatment plan. Therefore, her compliance may not be as great as you would want it to be. Therefore, your medical outcomes may be different. So it's a whole different way of shaping your conversations and your questions and your inquiries with patients.